I'm now going to introduce two people who have been very important to the school. First is Lan Benson. He's been the chair of our advisory council for the last 2 years. He's a member of the UT Health Science Center Development Board, the incoming vice chair of the National Children's Defense Fund, and this is very important because Lan has just this inordinate passion for children's health, and he's going to do wonderful things in this new role. He has, of course, a rich family history of civic involvement, bringing great insight to his role with us as the chair of our advisory council. This led him to become the chair of the campaign establishing the Senator Lloyd and B.A. Benson Center for Stroke Research at the UT Health Science Center Brown Foundation Institute for Molecular Medicine. He's the co-founder and executive vice president of Frontera Resources. His education includes an MBA from the Harvard Business School, and his greatest interest is in shaping a healthier future for his 2 young grandchildren and assuring that everyone else's health is as good or better in America's future. And I'm also going to introduce, while I'm here, Julius Glickman, who is the incoming chair of our UT School of Public Health Advisory Council. He has many civic involvements, which include being a member of the UT Health Science Center Development Board and its membership committee, past chair of the UT Austin Development Board and the UT Chancellor's Council. He is a generous benefactor with his wife Susan to UT Austin's Blanton Museum of Art, the College of Education, the College of Liberal Arts, and the Law School. He's chair of Humanities Texas, the state organization of the National Council of the Humanities. He has his undergraduate degree from UT Austin's Honors Program Plan 2 and his law degree from the University of Texas School of Law. He's a managing partner of Glickman, Carter, and Bashinsky, LLP. And importantly, as I now know personally, he bleeds orange, which as I've come to understand means a commitment to all things UT beyond anyone else's ability to fathom. I'm grateful for his invitation to me to spend the season opening UT game in his suite at Royal Memorial Stadium. I think his intent was to baptize me with complete immersion. And it worked. And for me and my daughter Sarah, who I'm proud to say is a freshman at UT Honors Program, we certainly got to see the best of UT football. So I'm going to go ahead and Lan, if you'll come on up.
Thank you, Dean Ness. Mr. Glickman may indeed bleed orange blood, but Dr. Ness, Dean Ness has burnt orange hair, and I think that's much more obvious commitment to the program. Chancellor Shine, Dr. LeMaitre, President Kaiser, Dean Ness, I've got to tell you that when I sit around and listen to what goes on, I feel like a muggle. I don't know if y'all follow Harry Potter at all, but a muggle is a person who has no magic. And as I sit around and watch what goes on at the University of Texas Health Science Center, not just in the School of Public Health, but across the board, magic happens there every day. And as a businessman, I marvel and want to do what I can to support it. I've served as the chair of the Public Health Advisory Board for the last 2 years, and come to understand what goes on there, and it's just amazing. Right now, we're seeing in the course of the healthcare debate, the challenges before us are coming into sharper and sharper focus. The push is to prevention, better public health. It's not that expensive, but it needs to be implemented, and that's a challenge that we all face. What we see, though, of course, at the UT School of Public Health is significant expertise, and we see it continuing to be recognized through its evidence-based scientific advances, and that will be improving your health and mine and my granddaughter and my grandson. They'll be attacking things like hypertension and diabetes and the H1N1 virus, and there's that whole host of things that are coming across there, as we were just speaking about in the chronic diseases. Now, one of the things we've been challenged to do as an advisory council is to increase the number of endowed faculty positions and scholarships. And at each of the 6 campuses, we need to make that happen. We want to recruit and retain the very best faculty that we can, who will in turn attract the very best students. And it's just a very simple progression in this academic setting. And so we need to develop those endowed scholarships, and we need to compete for those brightest and best students. And I'm pleased to report that we have added 3 new endowed academic positions and 10 additional endowed scholarships, and established 1 endowed lecture series that we'll hear more about in just a moment. We've had a series of regular meetings at the Advisory Council, and we had a successful strategic planning session. The members of the Advisory Council came to more clearly understand how important what a critical role we play as we begin to seek out backing for these scholarships. And as a council, we've seen that the private gifts often provide the difference between recruiting those folks. And in this day and time in particular, Texas is faring better than a lot of other places. And if we can come up with those scholarships, we can pry some of that very best talent away, as we have with Dr. Kaiser and Dean Ness in just the last couple of years. It really is an important part of our progress. So the School Public Health Advisory Council's members, they are from Houston and San Antonio, and we are working directly and aggressively to develop relationships in each of the other communities. This is to be a statewide board, and we need to have the endowed positions across the state along with the scholarships. It has been a real pleasure and honor to serve with Dean Parcells and Dean Ness. We have an extraordinary team, and we have an opportunity to see that opportunity grow under Julius Glickman, and I look forward to working with you and serving with you. Thank you very much.
This will do better if it's right side up. First of all, I would like to say that I am not the chair yet. I haven't been elected. So I think it's a little premature for Gene Vaughn and Phil Conway to start a petition for recall at this time. Just in case, I've appointed Mahmoud Ahmadinejad as my election supervisor, and he has advised me that I probably don't have anything to worry about. I accepted this position for 2 reasons. First, the UT School of Public Health is about preventing disease and changing behavior, as you have heard earlier. This school and this dean and the faculty here have given us the gift of potentially saving lives and changing the lives of millions of people. And I think it's an honor to be a part of this. Second, I'm here because we have another gift in this community with the arrival of Dean Roberta Ness. She's smart, savvy, and determined. And in an age where thinking of others is usually trumped by others thinking of themselves, Dean Ness's values is talking about others and what she can do for our children and our grandchildren land and the country as a whole, protecting us against infectious diseases like the West Nile virus, staph infections, discovering, as I've learned, the genetic links to heart disease, cancer, and the diabetes, and preventing damaging behavior which leads to teen pregnancy, AIDS, and teen violence. That's why I think through public health, the lifespan has been increased to 25 years, and 80% of that was because of public health. Roberta Ness is a visionary, but she's got her feet on the ground. She says she's going to make this the best school of public health in the United States. She can do it. But to do it, she's going to need our help to get the best faculty, the best students in facilities where they can do their job. Our advisory council can give her the financial tools to wage this war on diseases like swine flu and behavior leading to alcohol and drug addiction and many other things. And it can be done. Those before us eradicated polio, smallpox, they discovered penicillin, and they've educated the population about the alcohol and tobacco use. We are the heirs of this legacy. Much remains to be done. Safe air, safe water, safe environments in the workforce, and changing habits and dealing with mutations of behavior and bacteria. And obesity is one of those ways that we need to change behavior. But the job is not yet finished. So I hope you'll travel with us on this journey, and I don't think you'll be disappointed as being a part of the School of Public Health. Best of all, you'll have one of the best things that life can give, and that's the satisfaction from being a part of something that's just bigger than yourself and helping others and saving lives. And I look forward to this next year. Thank you.